Today I'd like to talk to you about the back side of the hip. Many times people have discomfort at the widest portion of their hip. This is called the greater trochanter. It is where there's a lot of attachments of muscles to bone. So there are tendon attachments all attached right here. And this is really important for the stability of the hip. The most common big muscle attachments there are the glute minimus and the glute medius, which both come in and attach to this portion of the greater trochanter. And people can have pain right there, and it's related to an injury of these muscle tendon complexes. Additionally, there are other tendons that are really important for hip stabilization. There's the obturator internis complex, which includes the gemelli, obturator internis, and so both the gemelli are superior gemelli and the inferior gemelli, as well as the obturator internis, and they attach down below to the back side right here. And they help control hip motion, and it's kind of like a rotator cuff that normally we talk about in the shoulder of the hip. So these are one of the important muscles for that. The other one is piriformis. There's a lot of discussion about piriformis as the reason behind sciatic nerve injury. So this is a sciatic nerve, and the piriformis runs right above it. Sometimes the sciatic nerve runs right through it. Sometimes there's other variations of it, like the sciatic nerve is in two different bundles, and one comes through it and one comes under it. In any case, the piriformis can become inflamed with that, or it can be injured separately, and it can create a disturbance to the sciatic nerve. All these tendons can be evaluated with ultrasound and then be treated with some of the regenerative medicine treatments, which include prolotherapy and PRP. Many times in my initial career as a sports medicine doctor, we talked about a bursa being the injury pattern here. And a bursa is a collection of fluid. It runs between a tendon and the bone, or a tendon and another tendon. It kind of helps cushion it. And we were told that any type of pain right here was a bursitis. We now know with ultrasound that's not always the case. And although sometimes I do see a collection of fluid and can call it a bursa or a bursitis, typically there isn't anything there, and it's actually a tendon attachment problem. In those situations, a steroid wouldn't weaken the tendon, so you don't want that, which is the typical treatment when you are diagnosed with a bursitis. So consider prolotherapy or PRP for treatment of your hip pain that many people refer to as on the outside of the widest portion of their joint. I'm Dr. Jennifer Stebbing. I'm a sports medicine physician. I have a specialty in regenerative orthopedics, and I'm here to help answer your questions. Please contact me. Thanks.